So today you're going to get my ideas on the terrain theory and the germ theory regarding dentistry and oral health and oral disease. So think about it. If your goldfish that you won in a fate as a child starts to sort of swim slowly and look really white and fluffy with some kind of fungus on its fins, and you look at the water and see that it's quite murky, what do? Do you go and give it to the vet to put some vaccines into the poor fish, or even some antibiotics? Maybe if it's really sick, an antifungal agent might be helpful. But ultimately, if it's got a chance to survive, what have we got to do? We've got to change that water. And we can't change it all at once, otherwise it'll just be too much of a shock. So incrementally changing the water is the strategy that we all knew and know to help our goldfish if we can save them. So what about oral health? You know, the mouth's on fire with disease, with gum disease, tooth decay, bad breath, you name it. What do? Do we pump lots of chemicals at it? Maybe if you don't want to take responsibility, maybe if that's what you want, you're a believer in allopathic medicine, you feel that fluoride is really good for you, even though it's a neurotoxin, you feel it's really good for you and you want to do it. I'm not going to tell you what to do. I'm maybe just getting you to question ideas and dogmas. And maybe you don't even need any kind of chemicals in your mouth, whether they're herbal ones, plant-based ones, or even chemical allopathic ones. Maybe all we really need to do is just start looking at our biological terrain. And that's not just in the mouth, we're talking about the whole body terrain. And when we get our body back into balance, especially our gut, amazing how magically the mouth comes back into balance. So when you study healthy people, especially in indigenous cultures, they're not brushing their teeth with toothpaste, they're not even washing with shampoos and soaps. You know, they just smell good, they're alive, they're vibrant, and they have a personal care regime. They'll brush their hair, brush their skin, brush their teeth, but they're certainly not using fluoride toothpaste, are they? Certainly not in the jungles. So that's my thoughts. Get you thinking, especially all you professionals out there, you know, who've been maybe a little bit kind of steered one way of thinking. In my profession, in dentistry, oral hygiene, your hygienists out there, your doctors who don't seem to really get too much insight into nutrition until into postgraduate times, when they might realize that that could be the missing link, is the management of our terrain and optimizing our terrain, maybe biohacking our way to an optimal terrain. So that's why I'm here. I'm here to just shake, rattle and roll and give you my perspective and give you maybe some dental biohacks that will help you on your way. You'll see them on my website, thedentalshaman.com, my YouTube channel, social media pages. I'm just going for it. You'll be hearing about it, seeing about it if you want to. All right? Or you can switch me off right now like this.